On May 11th, 2023, the CDC declared end of the COVID-19 public health emergency in the United States. Therefore, the CDC has modified what data it releases and has ended specific data sets. We will no longer be stating COVID metrics, but we will be continuing with doing the interviews. So Ivette, thank you so much for allowing me to interview you today for the Living Archives.
Thank you for having me.
Yeah. So go ahead and state your full name for me, any titles that you may have, and let us know where you're from.
My name is Ivette Ceballos. I'm originally born and raised in Ecuador. I'm a registered nurse with background in public health. I'm also a tobacco treatment specialist, and I'm currently working for Living Cancer Institute at Atrium Health.
Well, thank you for being here today again, and I'm excited to hear your experiences, especially being out in the field where a majority of the COVID-19 experiences probably happened. Well, you tell us what first comes to mind for you when you first started hearing about COVID-19. What kind of went through your head when it first came out? Did you see it immediately in the field, or was it something that kind of came along later?
So COVID-19 started at the end of 2019. I remember so vivid because I was about to leave the country to Europe. And I've noticed that our flights are starting getting canceled, and that there were some routes that we were supposed to switch from one country to the other. They were closing the borders. So then I started panicking a little bit because I realized that it was more serious than what we thought. I feel that it was more intense, and we have like a epicenter of COVID up north, New Jersey, New York states. And I had at that time my parents living there, and we were in South Carolina. So it was in South Carolina wasn't impacted as much and as quick as it was for northern states like New York, New Jersey. We were up down south still very relaxed about wearing a mask and being isolated and being very conscious of our signs and symptoms when it comes to COVID. I think we applied all those regulations probably a year later compared to up north. Because up north, I remember they were isolating everyone already. People were not allowed to be on the streets. People had to wear masks. As your witness said, New York was completely closed. Same thing with some parts in New Jersey. People started to stay home. You started seeing more cases, and people were very afraid to leave their homes and getting sick. But there were others that they were okay with it, that they didn't think it was something serious. And same thing happened on South Carolina and southern states when it actually hit COVID. It was by the end of 2020, I feel like it. And at that time, I was working as a home health nurse. So I had to go into different homes and take care of patients that they were homebound. And we will have our conversations. I will have to come into the house gown up. And they were like, oh, you don't have to wear that. That's not real. And then you have to bring that education to the populations you were serving. That especially for those that we were helping, they had like very fragile medical health-wise per se. And that was my biggest fear, to get COVID and bring it to the patients that I was visiting, because I would see about 3 to 4 patients a day. And that was one of my biggest concerns, aside to bringing it to my own home. So I would have to when I will get back from work, get changed in the garage, take all my scrubs out, and then as soon as I get home, jump in the shower before I'll give a hug or a kiss to my husband and kids.
¿Qué fue lo más difícil de trabajar con personas individualmente en su casa? Mencionaste que algunas de las personas tenías que educarles sobre, o sea, que tal vez no creían en la información que se estaba proveyendo con el COVID-19, pero en sí, ¿qué fue lo más difícil de trabajar en esa área y con los pacientes?
So I was working on Lancaster, Kershaw, Jefferson, which were like very isolated communities. They're considered outskirts. And I think the education there is even like it doesn't get to those small cities or towns. I think the vaccine and the education about COVID-19 became very political, and it was very hard for me to overcome that political barrier. So the way that I approach it, it was that I'm protecting myself, for putting it that it was for my own health rather than putting it on them that like you have to wear a mask, you have to do this, you have to do that. It was like I'm doing this because I don't want to get anyone sick. I'm doing that because I don't want to get sick. I'm doing that. So it was always more like towards like my belief with the virus and the purpose of what I was doing, all these things. Because at that time it was very unknown also for healthcare workers. We didn't really know what we were dealing with. We just knew that if there is someone that has a lower immunity or it's battling some sort of disease, they were more prone to catch it. And once you catch it, you're more prone to medical complications and even death. So when you see people that they're like, oh no, I'm, built strong, nothing can defeat me and things like that. You just bring it up on the sense that you're just there to protect yourself and others, nothing personal towards that person or others.
Yeah.
Very genetic per se.
Did any of your patients get COVID-19 during the time that you were a home health nurse?
So, thank God I didn't have anyone that had the virus, but in the middle of 2020, I transitioned to a federal job. I was working for the Catawba Service Unit for Indian Health Services, which was on a community clinic. So I feel that there was more exposed to the virus than as a community health nurse, because you're dealing with people that they're inbound, so they can't really leave their homes, and that's the main reason as a home health nurse you have to go to them. But I feel working for the community clinic exposed me most to the virus, and I was hired as a community health nurse, and since this whole virus thing, it was very new for everyone. I was the one that had to educate myself with the CDC, how to track it, monitor, how to share information. So we had like constant phone calls and meetings, at least twice a week with the CDC, to get very well informed on what is this virus and what's happening, how many people are passing away, and what are the complications, why people are recovering and some are they're not recovering. So it was very stressful, I have to say, because then you have these population that you're working with that will come to you very sick, and then a week later they will recover from it. But then you have these other group of people that they will get sick and they will pass away, and there were patients that you saw a month, 2 months ago. So it was very hard to distinguish like why some people can overcome the virus and why some can't. So I think that was the saddest part. We have a lot of patients at the clinic that passed away. There were like active members of the community. There were more geriatric populations, I have to say. But it really affect not only the clinic, but me personally, because then you get to realize how fragile we are.
And being specifically a community health nurse, I'm sure the relationships that you build with patients are even more connected, stronger, you invest more time with them.
Yes, and at that time, the clinic was only focusing on treating COVID patients, and we have to leave the clinic, we have to go on and then take care of them in the parking lot, so we can really provide like 100% care, because we were afraid that you going to bring it back, and then because it was very contagious, right? We had in the clinic different team members getting sick. So one will get sick, and then the next one will get sick, and then the next one will get sick, and so on. So you were always like afraid of like, when is my turn?
Oh my goodness. Did you get sick?
I did. I had COVID 3 times.
Oh my goodness.
I did.
Well, you worked in a very
Yes.
contagious field.
I got sick. I got COVID in 2021. It was the first time I got it, which was about 6 months after it was very heavy on positive cases on southern states. Mm-hmm. And I got really sick, and I recovered probably within like 3 to 6 months of my first time getting sick.
Do you feel like now you can, you know why certain people would get worse and why some people would get better?
So now we have research, medical research. Of course, we have broad data that you can use, versus before we didn't have that much information. So I feel like any statistics, any research work can always show you the main reasons why. So now we know that people with diabetes, obesity, or any comorbidities are more prone to have very bad outcomes with COVID. We also know that people with respiratory issues like COPD, asthma, emphysema, any respiratory illnesses will also not have a great outcome as well. We also know that COVID attacks more your respiratory system than other systems, but it's also known that it affects your cardiovascular as well. There is a lot of like sequelas, the COVID. Some people fully recover. Some may take them 6 to 8 months to be fully recover. We know that depletes our immunity. You're completely weak and prone to get not only COVID but other things, because all your immunity is working so hard just to battle that one virus. At that time, we didn't have any medication that will help us to recover from COVID. So you just have to drink water. You can only treat the symptoms, which was with acetaminophen or any mild medication for pain and discomfort. And now we do have antiviral medication that can help you to for the virus to leave your body faster. So you have less side effects, less sickness per se. So a lot of things had changed from the time that I was working with people than now that we have, thanks to more knowledge and information that we were able to collect.
Yeah. When you think back into your earlier experiences of when you were first hearing about COVID and treating it, dealing with whether you had a patient who had it or not, do you think is there anything that comes to mind that you would have done differently, or that you wish that the government or CDC would have done differently? Or do you think that we took all the right steps in with what we knew, with the time that we had?
I believe that we should have isolated a lot earlier, that we could have avoided spreading the virus. But you can't force someone to stay at home. You can't really force someone to do what you want them to do. And I think the only way is that you can bring the education and why it's important to have certain protection. It's like this saying, you can only lead the horse to the water, and it applies to everything in the medical field. You can only bring education, you can only bring the medication that can help you, vaccines that can protect you, but it's up to that individual to accept the information and follow your guidance, or they just don't, because you don't believe on certain things. I feel that once we saw as a nation that on these main states, port states like New York, New Jersey, Pennsylvania, California, Florida, which were the main states where you have main airports and a lot of traveling, should have been closed a lot earlier and try to avoid international traveling. But once again, we were saying, and we saw that there was a virus on the other continent, right? And we were on disbelief, and it was because we didn't know what was this virus about, and people continue to travel, and I was one of them. Like I mentioned, I had my tickets and everything to go to Europe, and I was trying to change the tickets to avoid those countries that they were closing the borders. And I was like, what am I doing? What if I get stuck there and I can't come back? And then is when I decided to fully cancel the flight. So the way I felt, I'm 100% sure that other people did, and that they were on disbelief that it may not be as serious as we think. And I also believe that once you experience it, you can sympathize with others. So once I got COVID, I was like, oh my God, it is really, energy depleting, and it's also gets you super weak, and you can't breathe. You can give 20 steps and get out of breath. And so it is a serious thing. I got it along with my younger son, so the two of us were isolating, and he was so good to go to the park and play, and on the meantime I was just laying in bed super weak. And so I really feel that now people that ended up having COVID, which I feel at this point at least all of us had it at least once, would realize how bad it was, and you just don't want to catch it again, so you're more mindful and careful. But with viruses, you really don't know if you're going to catch it or not. You only know once you're feeling sick.
What does the research now say about getting COVID a second time or a third time? Is your body better at handling it, or is it worse?
So it's natural immunity, right? We have the immunity that we get from vaccines, and then we have natural immunity that it's once we get the disease, and we also have the immunity that we get from our mothers, right? So when we talk about immunity, natural immunity, it will get your body ready to fight something that it's already recognized, right? So let's say when I got COVID the first time, I was super, super sick. I ended up having cardiac issues. I will have tachycardic episodes. So I had to wear a monitor for 2 weeks so they can track when I get these tachycardic episodes, but they were unknown. There was not any reasoning behind it why I will get these tachycardic episodes, because I never did that before, right? And And then I got it for a second time. And the second time I was sick, but I wasn't sick as much as I was the first time. And I also have to add, I was vaccinated.
The second time that you got it?
The first time, the second time, and the third time. So when I got it for the first time, I had my two primary vaccines. I had the Moderna, and then I got sick probably 6 months later. And then when I got sick the second time, I got my booster as well. And I got mild sickness per se. And then on the third time, it was like a common cold, some sort of an allergy. I still felt sick, but it wasn't as bad. It didn't take longer compared to the other times I had it. So the first time, I think I battled with COVID for like 6 months until I felt myself. And then the second time, it was about 2 weeks. And the third time, by my 5th day, I was fine, back at work.
So what would you say to people who argue that people still get sick even with the vaccine?
We still get sick, and we get that a lot. So I'm glad you asked that. I think I consider myself a very healthy person, and I had to go through that. So I can imagine someone without the vaccine, how they're gonna feel like. Someone that experience COVID without the vaccine will be the right person to say it and compare versus someone that actually had the vaccine or how they felt after they have the vaccine. But I can tell you that most of the population that we had worked with that had the vaccine were able to recover compared to those that when we were on the unknown phase that we didn't have a vaccine available ended up passing away. So it's like the flu. You vaccinate every year for the flu, you may still get it, but you may not get it as bad as without the vaccine. So it's obvious I'm pro-vaccine, working on the medical field, but you also have to take in consideration that not everyone it's a good candidate for the vaccine based on the medical history, and that should be under the doctor's discretion. Is it doable for this patient to have a vaccine compared to this healthy individual that haven't received the vaccine? And the vaccine also gets you sick. People will get the vaccine and then will be very weak the next day, very tired, and then they will bounce back the next day. So when we were vaccinating people as well, we were giving them the heads up, you may feel sick, but you may not feel sick. So everybody was different.
So how was it for you? Because you seem to have done different jobs within the last 3 years, because now you work in a different job.
I just started.
Yeah.
Yes, I started on January.
So since COVID-19 started until now, you've had 3 different jobs, right? How have you been able to see? They were all in the medical field, but would you say that that you've seen change within each one of them because of how changing or how modified, how rapidly COVID-19 has changed? Or do you feel like you've been able to see a consistent way of how things developed in each of your jobs?
So when I was working as a home health nurse, I just did that. I was just COVID hit, and I was just right on the transition from this job to the federal government job. And so I worked as a home health nurse for about 3 to 4 months before COVID hit really bad. So I didn't have that exposure as much working on home health with COVID. I know that we had to protect ourselves and wear PPEs before we go to the patient's home and all these. And then working for the community health clinic for Indian Health Services, it was the same process. Like, we have to work PPE, we have to disinfect and wash our hands and all that before and after each patient. Now working for LCI, and we're talking about 3 full years post-COVID, the regulations are more relaxed. And it's because we have more knowledge about the virus. But I work for Living Cancer Institute, where we work with very weak patients that are going through treatment. When I walk into the building, I will still continue wearing a mask, because you don't know where you're going to touch or who you're going to see or who you're going to say hi or who's going to pass next to you that may have that weakened immunity, that it's a high risk from catching it. So I believe that in facilities like Living Cancer Institute and facilities that dealing with people with autoimmune diseases or with diseases that weakens your immunity should continue the practice of protecting yourself so you don't get that patient sick. Because once they get sick, you don't know if the outcome is going to be a good one or a bad one. Okay. And as a human being, as a professional, I wouldn't want to carry that on my shoulders, that because of me, someone passed away.
Yeah. So the decision that you're making to still wear a mask with your cancer patients, is that a personal decision, or is that a policy that you have to follow still with?
So I'm so used to wearing a mask when I'm dealing with patients. So that's, I guess, it's a personal decision. Especially if I know it's a cancer patient, a cancer survivor patient, or cancer related. But the policy on our facility is just for the living cancer buildings. But then if you're on the other buildings, like let's say gastrointestinal, same day surgery, you're not required to wear one.
Okay, so those are policies.
Yes.
Yeah.
So depends what department are you visiting or you working at.
Well, we've talked a lot about your job and how you've experienced COVID-19 in different positions within the healthcare field. But what about at home? How was it for your family to know that you worked in the healthcare field, you could be exposed to it? How were they feeling and how were they experiencing it?
So my husband is a saint. He had to deal with all that. I feel horrible because I feel that all the load was on him, because he continued to work through the whole pandemic. He was working from home, and then the kids were homeschooled, and I had to be out on the field. And he had to take the responsibility of homeschooling the kids while he was doing his full-time job. And then I will come home and he will have dinner ready for me, because he'll know that I was gone from the morning, afternoon. I think that we were very careful and we became very not as touchy. Like, we weren't giving hugs to each other. Same thing with the children. I was trying to keep away from them just in case. And this is something that happened for about a year or so, where we learn about the vaccines and learn about signs and symptoms, and where COVID tests were more accessible than any other time. So if you feel a little bit sick, you will test yourself really quick before you touch anyone, right? So I personally feel that I was very active on the field, helping people going through COVID, providing information and vaccinations. But on the other side, my husband was the one that's carrying all the load. So if anything, I should be extremely thankful for all the things that he actually did to support me. because it was hard for him. Like, he carried most of the work, because having two children homeschool, and he had to work full time, and me being out and not wanting to leave the house to do groceries, and having to disinfect myself in the garage. So it was hard. It was hard, but thank God we're on a different phase now.
Yeah.
We learned from that.
Yeah.
And
I don't know how your husband did it. Working
did.
full time and having his children homeschooled.
Yes.
Because they're not in the same grade either.
Grade, no.
They have different
So
materials
he was very
curriculums.
organized on that, and like I said, it's kudos to him. He did most of the work. I was working on the field in a different way, but I wouldn't been able to help and do what I did if it wouldn't been for his support.
Yeah. Well, we thank both of you.
You're so sweet. Thank you.
Yeah. No,
Yeah.
the kind of work that a lot of teachers, nurses, doctors, and families who supported their work, I think, definitely is at the forefront
Impacted.
of
Yeah.
the reason why we are where we are today, where we can say that it's not as bad
Yeah.
and we are getting better.
Yes, and with more research, I have a full faith on science. I'm a person that believes on science. That's why I'm on the medical field. I feel like if we base it off on statistics and evidence-based practice and all this wonderful research that came up after COVID, I even have more faith on it. I think we were able to overcome it thanks to vaccination and education in communities and the protection and steps that we took. I believe that now, as a society, we think that COVID is like another wave of flu, right? Like, oh, we may get it, but we're gonna be okay, and it's great. But then when you go back years ago and you remember people that were dying from it, I think it really impacts you, and it's a story that you can carry on different generations. Like, when I get older, I want to tell my grandchildren that, oh, we went through a pandemic, and they will never believe us. Like, what do you mean? What's a pandemic? I think it really helped us as a society to become more close and understanding, but it can also separate society as well, because we have differences of opinion, and I'll respect both. Mm-hmm.
There's a question that come to mind. When we were kind of talking about how quickly we've kind of, I would say, quote unquote quickly, we've gotten to from where we were back at the end of 2019. I can't keep on thinking about how much research and time and efforts have also been put into cancer research.
Mm-hmm.
And yet it seems that what we hear is that we still don't have a cure for it.
For cancer?
For cancer, yes. So how do you, what would you say, how did we get to this almost like solution for COVID-19 so quickly?
So there is one cancer that there is a cure for it, and it's thanks to science, and it's cervical cancer. Now we have a vaccine that can prevent anyone from getting this type of cancer, right? There is, and it was thanks to research, right? So with COVID-19, it helped us to get quicker to a vaccine or to a solution or to a resolution of the virus, because it was a pandemic. You were getting so much data in such a short time, not from one country, but from multiple countries, that you can come up with like really tangible data that can help you to move forward from that. So if scientifically it was proven that with the vaccine there was less incident rates on the sense of people getting the virus, or even like more a higher rate of survival, I believe that's why it was implemented, the vaccine, because you can collect information in a short period of time from other sources versus then just the ones that a small group that you have available to work with. So,
and cancer cells are very known to modify really quickly too, right? So
yeah, and cancer, it's also genetic. It's also your lifestyle, like colorectal cancer is what you eat, if you have a healthy weight. But it also, very healthy people can get it because their mom, the father died from colorectal cancer. Someone with lung cancer, we know lung cancer comes from heavy smokers. But what if someone that didn't smoke had lung cancer? It was secondhand smoke, was work related, because back in the day, people that used to work with asbestos, they didn't wear PPE or protection for their respiratory system, and then nowadays we see that people have lung cancer due to that. So I don't know if you've seen on the commercials, if you've been working with asbestos and you have such and such, call such a lawyer and this and that, because data prove that if you were working with asbestos and you were not protected, you're most likely gonna develop this kind of cancer. So with cancer, there is an opportunity for different ways to get it. We're talking about genetics, we're talking about lifestyle, and we're talking about health-wise overall, like how healthy you are, how we're treating our bodies. And with COVID, I feel the research really support on knowing how helpful the vaccines are, number one. How we protect each other wearing like a mask or a PPE or other type of measures, and how some people recover better than others. Like, we have enough data that, if your immunity is depleted, you may get a lot sicker than others. And yeah, I think, the innovation of medicine was, because they used to ask me how they come up with a vaccine so quick when there is other diseases that it takes multiple years for them to come up with a vaccine. So when you're doing medical trials, you only have a small group of people to work with, which makes it harder for you to come up with your conclusions. But if you have an entire
world,
globe and country and cities and states, and it's like everyone, you can collect data from different places. I believe it's a lot easier to come up with conclusions than when you have just a small sample group that you can work with. So I used to explain that to patients, to put it on perspective for them to understand why we have a vaccine now.
Are there any particular stories that come to mind about where you worked in COVID-19?
I think I had one of our patients, like I mentioned, we were taking care of him. He was COVID positive. He was a Native American when I used to work for IHS. He was part of the board of the Catawba Service, Catawba Nation. And he was very influential. He was one of the elders of the community, and we were trying to help him to recover from it. And it was super sad because he passed away within a week of having the virus.
That was very short.
Yes. So it was very sad, and it was a very eye opener on like how fragile we are. I think that was one of the most impactful ones, and just my parents.
Your parents got it too?
So I think it was hard for me personally because my parents were in New Jersey, and my mom and my dad weren't leaving the house, and they were very like anxious. I think mentally they weren't in a good space, and I couldn't do anything because I couldn't travel to them, or they couldn't come to me. And I think it took, as a society, a huge toll on our mental health.
Yeah, just in general.
Yes.
Yeah.
Everyone that lived through it will always remember it, and it's something that's gonna go in generation after generation.
Yeah. So you mentioned, I wanted to go back a little bit to what you mentioned about the elder who you worked with, who had COVID-19 and passed away only a week later. And you mentioned how he was very ahead of, or known within the congregation.
Yes.
How did you see a change in the community itself? Were you able to see that, or were you more distant from that?
It was like in any other community, there were two sides: those that they believe that they can harm you really bad, and those that believe that it was just a common flu and it will go away. So for those that didn't believe much about it, I don't think it changed their mind, because some people are just set on their ideas. And
so even that death, you don't think changed?
I don't think it did. I don't think it did. I think some people may open up their eyes to be more careful about it, but for some didn't, because it was like some people believe in it and some didn't. I think it helped a lot on the education and protection, but it was in a rural area, and they weren't true believers on COVID, and it had happened that some people might have gotten sick and they were like, oh, but I'm fine now. So it wasn't nothing. And then that person would talk to the other one and the other one and the other one, and it was just a rumor. Then it was the rumor about the vaccines that we were getting implanted, like chips on our arms with the vaccine. And there was a little miseducation and misconception out there that I always have to absorb that and understand that it's just because of lack of communication and education. And then when someone is set on something, anything you do or you work towards to, it may not change their mentality. So I kind of learned how to pick my battles on that. I was at the beginning when this was happening, I would see people dying. I was very passionate about it. But then when you see the reaction of the population or how they feel about it, you kind of become more, not relaxed, but more acceptance that, hey, like this is something that not everyone is going to agree with you, and you just go with it. Yeah.
Well, is there anything else that you wanted to share with us? Any other stories, any other experiences or thoughts about COVID-19 that we haven't touched up on so far?
Not really. Just, if you still have the opportunity to get vaccinated, go for it. Very big on vaccination. Not only COVID vaccination, but vaccination overall, because that's really make us continue as a society. Thanks to vaccination, we have new generations. And if there is something that you're knowledgeable about, just educate yourself. Look for reliable resources don't just base it off something that you saw on Facebook or something that was said on the news or something, because sometimes the news also alarm too much, and it makes people change their mentality and how they think, and I feel like as human beings we should educate ourselves and think about or do our own research on something that we don't have knowledge on.
So gather more.
Yes, absolutely.
More so that you can make a sound information.
Read good articles. Like there is very good, reliable websites, and
which ones
we
would you
have.
Recommend?
So
in terms of reliability,
NIH is one. It's where we get most of our information.
NIH.
Yes. Then we have PubMed. We have the Institute of Cancer. Then the CDC, it's a good resource as well. HHS is another good resource. And then there is great articles and research that you can find on libraries, university libraries, that sometimes you have to pay to read those amazing research. And if you're in school and you have access to a free library, like it's a good resource for you to pull like actual research.
Mm-hmm. And public libraries also have available to, like, databases.
Yeah.
Yeah. Mm-hmm. Yeah.
I didn't know that.
Yeah. We have ProQuest.
ProQuest, yeah.
Yeah.
Good. So that's a great resource to pull like good research if you're interested on finding more about anything. Mm-hmm. I feel like educating, I'm so big on education. Knowing more doesn't hurt you, so why not go for it?
Yeah. Well, Ivette, thank you so much for your time, welcome. For sharing your experiences with us, and I'm excited to see all this pulled together. So thank you so much.
Thank you for having me once again.
Yes.